Welcome back to The Explainer. Today, we're tackling one of the absolute biggest, highest stakes forks in the road that every single senior faces, choosing the right Medicare path. Seriously, this is a decision that can completely shape your healthcare and your finances in retirement. And look, I get it, it can honestly feel incredibly overwhelming at first glance. But don't worry, we're going to map this all out right now so you know exactly what your options are.
Okay, let's dive right into this because this isn't just some simple box you check on a form and forget about. One of the biggest mistakes seniors make when signing up for Medicare is choosing the wrong type of coverage just because they don't fully understand how it actually works in practice. And the harsh reality is, picking the wrong path now, that's a decision that can easily cost you thousands of dollars down the line.
I want you to really imagine this scenario for a second. You think you're completely covered, and then, you get sick. Suddenly you discover that the doctor you've trusted for a decade isn't covered under your plan. No way, right? Or you find out you need an unexpected referral just to see a specialist, which ends up delaying your vital care for weeks. Or maybe worst of all, you open a medical bill and find yourself facing much, much higher out-of-pocket costs than you ever budgeted for. These are painful, expensive surprises, and they literally happen every single day when people don't fully grasp their Medicare choices.
So to make sure that doesn't happen to you, we're navigating your options today. We're going to cover the basic difference, doctors and travel, extra benefits and prescriptions, costs and spending limits, and finally, choosing your best path.
Let's start with Section 1, the basic difference. Now, it's really important to know right off the bat that both Original Medicare and Medicare Advantage provide your basic health coverage. Their engines both power the essentials, things like hospital stays, standard doctor visits, necessary medical tests. But the way those engines are built and how they operate, vastly different. Original Medicare is the traditional health coverage program, and it's run directly by the federal government. This is your baseline. When you think of the historic standard government program that's been around for decades, providing that broad safety net for seniors, this is the one. You deal directly with the federal system. Then we have the second path, which is Medicare Advantage, also commonly called Part C. Now, this is a bundled alternative, but instead of being run directly by the government, it's actually offered by private insurance companies that are approved by Medicare. If you think about the private health insurance you probably had through your employer during your working years, with its specific networks and plan rules, well, Medicare Advantage looks and feels a whole lot more like that. And that core difference, government direct versus private insurance, that completely changes which doctors you can see, what you pay, and how flexible your coverage actually is.
Which brings us perfectly to Section 2, doctors and travel.
Let's see how this actually builds into your everyday lifestyle, starting with a massive deciding factor, doctors and referrals. The trade-off here is abundantly clear. With Original Medicare, you have incredible freedom. You can visit almost any doctor or hospital in the entire country that accepts Medicare. Want to see a specific heart doctor or a dermatologist? You usually don't need referrals. You just call, schedule, and go. It's that easy. Now compare that to Medicare Advantage. Because it operates like private insurance, you are dealing with provider networks. You generally have to choose a primary care doctor. You often have to get a strict referral before you can even see a specialist. And if you go out of network, well, it's going to cost you a lot more, or your plan might just not cover it at all. And that network restriction bleeds right into how you travel too. Original Medicare works practically anywhere in the United States. It gives you true nationwide convenience. Medicare Advantage, however, operates within local service areas. Your coverage is highly regional. So if you step outside that specific geographic region, your coverage gets restricted, usually to just severe, life-threatening medical emergencies. Let's ground this in a concrete reality for a second. Think about the classic snowbird lifestyle. Let's say you're splitting your time between a winter home in Arizona and a summer home in New York. If you're on a Medicare Advantage plan that's based in Arizona and you decide you need a routine checkup or just some non-emergency care during your summer in New York, you might have a really tough time finding an in-network doctor. If traveling, visiting grandkids across the country, or living in multiple states is a big part of your retirement dream, you absolutely have to consider this geographic limitation.
All right, moving on to Section 3, extra benefits and prescriptions.
Let's shift our focus to the extras, because for many, many seniors, this is the ultimate deciding factor. When we compare the two, notice that on the Original Medicare side, the basic things you really need as you age, routine dental care, vision exams, glasses, hearing aids, they are simply not usually covered. If you want them, you have to buy entirely separate insurance. The exact same thing goes for prescription drugs. You have to go out and buy a standalone Part D plan. But look over at the Medicare Advantage side.
Dental, vision, hearing, and prescription drugs, they're usually all included. It's just a simple all-in-one bundle. And honestly, for a lot of seniors, having one single card that handles the whole shebang is just incredibly appealing. Now, for Section 4, costs and spending limits. So obviously we can't make a huge life decision based on the perks alone, right? We have to prepare for the most stressful part of healthcare, the money reality. I really need you to pay close attention to this because it's terrifying for a lot of people. If you are on Original Medicare, there is no yearly cap on your spending. Let me repeat that because it's absolutely crucial. There is no maximum limit on your out-of-pocket costs. You pay your deductibles, you pay your coinsurance, and if you have a massive prolonged health crisis, your financial exposure is technically unlimited. Because of that glaring lack of a spending cap, most seniors on Original Medicare don't just stop there. They buy additional coverage to bridge the gap and protect themselves from surprise, ruinous medical bills. They buy what are called Medigap policies, or they use employer retiree plans, or they rely on Medicaid if they financially qualify for it. You essentially have to build your own safety net, which means managing multiple premiums every single month just to ensure you're fully protected. When we compare the financial predictability of the two, the contrast is super stark. Original Medicare leaves you with unlimited financial exposure unless you go out and buy those extra Medigap plans. Medicare Advantage, on the other hand, comes with clear copays and, most importantly, a strict maximum yearly spending limit. It puts a hard ceiling on your financial risk. Once you hit that out-of-pocket maximum for the year, bam, the plan pays 100% of covered services. And that gives a lot of people profound peace of mind when budgeting for their retirement years. Oh, and a quick side note before we bring it all together, what about international travel? If you're planning on touring Europe in retirement, you should know that neither Original Medicare nor Medicare Advantage typically covers care outside the U.S. Now, some Medigap policies or specific Advantage plans might offer limited emergency foreign coverage, but you absolutely must check the fine print carefully before you ever board that plane. Finally, Section 5, choosing your best path. We've laid out the facts, the limitations, and the costs. Now, we enter the verdict stage. Let's bring all this information together so you can make an informed choice that perfectly fits your specific lifestyle. Basically, you're the ideal candidate for the Original Medicare path if freedom is your absolute top priority. Choose this route if you want the maximum freedom to choose your own doctors without ever needing referrals. Choose it if you plan to travel frequently across the United States and want your coverage to just travel seamlessly with you. If you despise network restrictions and you're willing to coordinate a Medigap and Part D plan to protect your finances, Original Medicare is for sure your best bet. On the flip side, you're going to thrive on the Medicare Advantage path if you love simplicity and predictable costs. Choose this option if you want lower upfront monthly premiums. Choose it if you really want those extra lifestyle benefits. The routine dental, the vision, the hearing coverage, all baked right in. If you want a simpler, all-in-one combined plan with a built-in safety net for your yearly spending, and you really don't mind staying within a local network of doctors, Medicare Advantage is going to feel like a great fit. It just offers a reassuring, streamlined approach to your healthcare. Ultimately, making the right Medicare decision today is going to save you immense amounts of stress, frustration, and money tomorrow. Take the time to really understand these trade-offs before you ever fill out an enrollment form. So now that you know the difference between the two main paths, you're ready for the next level. Because honestly, picking the wrong path is just the beginning. You absolutely must explore the other traps waiting for you. So what are the biggest Medicare mistakes seniors make after turning 65? Well, that is exactly what we're going to unpack in our next explainer. And trust me, you do not want to miss it. Keep learning, keep focusing, and I'll see you there.